Hey, all right. Well, good afternoon, everyone. On behalf of the University of the West Indies, and more specifically, the Caribbean Institute for Health Research, which is both a pleasure and an honor for me to welcome you all, friends, colleagues, well-wishers, to the virtual launch of the 2024 Small Island Developing States Report for the Lancet Countdown on Health and Climate Change. But to begin with, I'm actually going to take you back in time and talk briefly to history and really about life in the Caribbean in the 1930s. So the Caribbean really consists of many small island developing states, and in the 1930s, they were colonies of European governments. And at the time, we're still struggling with the economic impact of the Great Depression and issue with low yield from agriculture, which had resulted from plant diseases. At the time, a lot of the employment for persons living in these communities were on these large sugar plantations and the factories associated with them, and workers were hired on low wages in order to maintain profit margins. At that time, there were a number of migrant workers who were in different parts of the region, from Panama, Cuba, Costa Rica, and the United States. And they began returning home in this period and were dissatisfied by the economic and social conditions in their home countries. And this resulted in unrest. Later on, leading to a series of uprisings, starting in Belize with the lumber workers in 1934, and by 1939, nearly every island in the Caribbean had undergone some sort of unrest. It was the British government at the time that recognized what was going on and sent a royal commission to investigate and report on the situation, while also offering some possible solutions. And this report of the West India Royal Commission, also known as the Moyne Report, is credited for us in the region as having the biggest impact on the health of the Caribbean. So while the commission had started its work in 1938, the final report was really not made public until after the Second World War in 1945, as some of the findings and recommendations were considered far too radical and socially disruptive for British government and Europe on the brink of war. The Moyne Report described the deplorable living conditions in the islands, with poverty and poor housing, lack of education, inadequate public health infrastructure, resulting in high rates of maternal and child mortality and childhood malnutrition. There was rampant infectious diseases and very poor life expectancy. And many of the small island developing states in the region lack the human resource capacity to respond to these threats and challenges. And so the Commission's report led to the establishment of the West Indies School of Public Health to address health issues. And this was soon followed by the Irving Commission, which recommended the establishment of the University College of the West Indies to address the need to train Caribbean nationals, starting with a School of Medicine. So I'm going to bring this all home. So the University of the West Indies, which is the host for this center, was started as a college of the University of London in 1948. And it was into that environment that the institute in which it stands, the Caribbean Institute for Health Research, had its genesis. And this was really in the building of the Tropical Metabolism Research Unit by the UK Medical Research Council. And it was built the same time that the University Hospital of the West Indies to train the medical graduates was also created. The TMRU was founded by Professor John Waterlow in the 1950s, and this work really focused on addressing one of the big public health challenges of childhood malnutrition in those days. And the work that was there helped us to understand the pathophysiology of severe acute childhood malnutrition and how it should be managed. And this has really transformed how this crisis is managed and saved countless lives throughout the world. Today, we're launching another report, this one highlighting a new threat, not necessarily from some of the social disorders, but the new threat of climate change and the effect that it has on health and development, not only in the Caribbean, but also looking at other small island developing states around the world. And so the Lancet Countdown Regional Center for Small Island Developing States, that's housed in the Tropical Metabolism Research Unit of the University of the West Indies Caribbean Institute for Health Research was established to track the progress that was being made on health and climate change by bringing together institutions in the Caribbean Sea, as well as institutions in SIDS in the Pacific region, as well as within the region spanning the Atlantic and Indian Oceans, the Mediterranean, and South China Seas. So as we share the findings from today's report, you're going to be hearing from some of the key stakeholders. You'll have an opportunity to interact with the authors of the report that will be presented, have a chance to ask your questions, share your thoughts and ideas. And we want to thank you for taking the time to join us and hope that you will leave this meeting with a new perspective, that you'll be energized, ready to tackle the emerging health issues in your own respective countries. So I will now let the program continue. As you have seen in the program, we have a number of greetings and messages. And I think the first one is going to be from Dr. Kafour, who is the director of the Public Health Division at the Pacific Community. And he has over 20 years of experience in the health sector as a national, regional, and international level. And he will bring us the perspective from another part of the world. Dr. Kafour, over to you.
Thank you very much, Professor Marshall, and greetings to your colleagues in the audience. Dr. Marina, the Executive Director for the Global Lancet Countdown on Health and Climate Change. Dr. Georgiana, Executive Director for the Regional Center for SIDS and Lancet Countdown for Health and Climate Change. Distinguished fellow speakers and panelists, ladies and gentlemen, and our youth. On behalf of Dr. Sala, our senior epidemiologist in the division, a warm Pacific greetings from us in the Pacific community. And honored to be a speaker at the launch of the inaugural 2024 SIDS report on Lancet Countdown on Health and Change. I take this opportunity to congratulate the Regional Center for SIDS on the Lancet Countdown on Health and Climate Change and the launch of their inaugural report. The Pacific is a very vulnerable region. Apart from its fragile health systems and economies, 4 of the top 15 countries in the Global Risk Report are from the Pacific. Indeed, it does not capture, the risk report does not capture how this risk is exacerbated by the NCD crisis, the least access to water, one of the lowest access to water, and diminished workforce. Climate change has increased the frequency and the strength of weather in the events in the Pacific Island countries. So much so that we have advised our health colleagues in the region to assume that they will have one natural disaster secondary to climate change every year, and to take action with that assumption. The hurricane season in the Pacific in 2023 costed $13 billion US. Apart from these, we also have a burden of infectious disease and non-communicable disease, and the increasing heat of climate change pose a risk to the vulnerable populations with the NCD crisis that we do face. Recently, we've had, through our SPC, the Pacific Community's Regional Epidemic Intelligence System, have indicated unprecedented and concomitant waves of circulation of arboviral outbreaks, with recent outbreaks in dengue and pertussis. Apart from this, the impact of sea level rise, a recent study has shown that 60% of essential health facilities is within 500 meters of a hydrological threat, leaving approximately 60% of our population vulnerable to losing health services. Climate change also has an impact on the arable land and affects our food systems, including our marine life. Of course, the Pacific supplies the largest percentage of the world's tuna, and fish is an important protein source for our people. This increases the affection of this food system increases the reliance on imported foods, further worsening the NCD crisis. Regional strategies like our Pacific Island Forum Leaders 2050 strategy, the 2024 Pan-Pacific Conference on Health and Climate Change have started to take an impact on providing direction for a concerted effort towards climate change and health at the regional level. Our Pacific Island leaders have been pioneers in crafting migration and displacement policies in response to climate change and its impact on rising sea levels. And the Australian Tuvalu Falepipi Union is an example of that. And also with the Kiribati in Fiji agreement is another example in there. Although the small island development states contribute less than 1% of the world's greenhouse emissions, we are the first, probably in the Pacific, to be the first countries to disappear with the rising sea levels. The SEEDS report on Lancet Countdown on Health and Climate Change provide policy, scientific backbone to policy advice for all of us to use to take action. It provides demands on immediate action, provides the signs that our planet is warming in an unprecedented rate and the consequences of it, and it's on every aspect of our life. This report provides a roadmap outlining pathways to a sustainable future for SEEDS. For the region, the Pacific, it provides the evidence to support the attainment of our 2050 strategy for the Blue Pacific continent and 2050 Healthy Islands vision to protect health from the impact of climate change. It also highlights that the Pacific community needs to provide sound data in support of the Lancet's work and the Pacific community's commitment with the Lancet Countdown on SEEDS regional work to filling the research and data gaps that are needed by the Commission. We make a commitment to support the Commission in its work by trying to get data from our Pacific Island countries. Lastly, I leave you with a statement that I think was ahead of its time in 1985 and recently re-looked at in 2015. It's called the Healthy Islands Vision, and in respect to our predecessors and health leaders in the Pacific Island countries. There's 4 main statements: that children are nurtured in body and soul, body and mind. Environments invite learning and pleasure. People age with work and work with dignity. Ecological balance is a source of pride, and the ocean which sustains us is protected. Thank you very much, Prof. and the Lancet Commission for this opportunity.
Thank you very much, Dr. Kapoor. Right, so we move from the Pacific Islands to the Caribbean, and our next message will come from Dr. Lisa Indo, who is the interim executive director of the Caribbean Public Health Agency. She's been in this role since 2014, and she was also responsible for leading the response to Hurricane Beryl and the MPOX, and she's currently serving as Director of Surveillance, Disease Prevention. This is Surveillance and Disease Prevention Control Division since 2020. So at this time, we'll hear remarks from Dr. Indo.
The Caribbean small island developing states are prone to natural disasters such as hurricanes, flooding, and earthquakes. The United Nations Office for Disaster Risk Reduction, UNDRR, indicates that Latin America and the Caribbean region is the second most disaster-prone region on a worldwide ranking. Climate change, driven by global warming, is the main driver behind the increasing severity of hydrometeorological events, as seen by the number of severe Category 4 and 5 storms experienced by the region over the past 5 years, as well as longer, more intense drought periods. The impact from such storms includes loss of lives and livelihoods, decreased manpower, heavy building infrastructural damage, reduced ability to provide public health services, and increasing disease incidence. Other impacts of climate change involved reduced food security through changes in arable land available for agriculture, rising sea levels, oceanic acidification, and saltwater intrusion into water reservoirs. In 2024, the National Oceanic and Atmospheric Administration predicted an above normal hurricane season with 17 to 25 named storms. Hurricane Beryl, which severely impacted the islands of the Grenadines, was the earliest Category 5 storm on record to hit the Atlantic basin. The devastation to these islands was great, with more than 90% loss of infrastructure recorded on Carriacou. Other islands in the Grenadines that were heavily impacted include Petit Martinique, Union Island, Meru, as well non-Grenadine islands such as Tobago, Barbados, Southern Jamaica, Cayman Islands, and Belize. The total damage approximated across the Caribbean was greater than 500 million US dollars, and the estimated cost, for example, to health infrastructure in Jamaica alone was approximately 12 million US dollars. The impact to human lives and livelihoods were also significant. Approximately 160,000 people, including 37,000 children, were affected in some way, according to the UNICEF. Climate change has been shown to have impacts on both communicable diseases as well as non-communicable diseases. There have been increases in the frequency and severity of climate-sensitive disease outbreaks such as dengue over the past 15 years. Heat records have hit all-time highs in both the Caribbean and across the globe, and this can impact vulnerable populations such as those living with NCDs. It is well noted that the greatest burden of disease in the Caribbean falls on the NCDs, which are the leading cause of death, causing approximately 75% of all deaths according to the WHO, as well as disability in the Caribbean. In 2019, the Intergovernmental Panel on Climate Change acknowledged SIDS as being amongst the most vulnerable affected by climate change. There's also the issue of climate justice issue, where SIDS collectively produce less than 1% to the greenhouse gas emissions, but bear the brunt of climate change impacts. All of the aforementioned provides credible evidence for concerted and combined regional action. CAFA has long recognized the impact of climate change on the health of the Caribbean people, and in 2017 issued the State of Public Health in the Caribbean 2017 to 2018. Following on this, I would like to congratulate the Regional Center on Small Island Development States of the Lancet Countdown on Health and Climate Change on the launch of their inaugural report. This inaugural report and future annual iterations can support the mandate and vision of CAFA, specifically healthy people, healthy spaces, healthy Caribbean. The annual report will help us to monitor our progress towards the Paris Agreement and give us an opportunity to celebrate our successes, identify areas of inaction, and adjust our initiatives to achieve expected results. CAFA looks forward to greater collaboration with the Lancet Countdown Regional Center on matters of critical importance related to climate and health for the Caribbean small island developing states. Again, our heartiest congratulations, and I thank you.
Thank you, Dr. Indo. The next three presenters are going to be speaking from a clinical perspective, and we're going through the lifespan. And our first presentation is going to come from Dr. Abigail Harrison, who is a senior lecturer and head of the Department of Child and Adolescent Health at the University of the West Indies, that's based at the University Hospital of the West Indies. She's also the president of the Caribbean Association for Adolescent Health and the president of the International Chapter for the Society for Adolescent Medicine and Health. And she will bring the first message on the response of the younger people to climate change.
I'm Abigail Harrison, a practicing pediatrician and adolescent health specialist in Jamaica, one of the small island developing states in the English-speaking Caribbean. Over the 15 years, I have noticed on my own personal space that there have been changing shorelines and increased health issues for our children and adolescents in Jamaica. We can most certainly point to the increased frequency of dengue outbreaks that we have noticed in the past 15 years of my practice. And in addition to that, chikungunya and Zika virus have also joined. This is likely due to the increased temperatures that we've been noticing with climate change, the increased rainfalls, which of course form a perfect breeding site for our mosquitoes. So arboviral infections are on the rise. And unfortunately, this leads to increased frequency of sickness and even more so, concerningly, death among our children and adolescents. We also have seen increase in respiratory illnesses, so allergic rhinitis, allergic sinusitis, as well as asthma. And this is due to increased pollutants and increased dryness with the increased temperatures. Of particular concern to me, however, is the worsening mental health outcomes that we have. We have noticed that we have far more of our young people having concerns about climate change globally, regionally, and right here in Jamaica. This has led to increased sense of powerlessness, anxiety, fears, a sense of hopelessness even in what the future will hold for them and their next generations. Now, in the small island developing states, agriculture forms a significant part of the workforce in terms of offering jobs. With climate change, these jobs are going to be diminishing. This again adds more stressors to our young people. This in addition to the other realm of concerns, inequity in educational opportunities and vocational choices. Now, in spite of the challenges I've mentioned, I do want to pause and congratulate the Regional Center on Small Island Developing States of the Lancet Countdown on Health and Climate Change on the launch of this really important inaugural report. We indeed have to continue to advocate loudly whenever and wherever we can, involving our youth in all high-level meetings. Their voice must be heard, their perspectives must be considered and included. Climate education in school curricula at all levels, primary, secondary, and tertiary, must be considered a low-hanging fruit that we must and should immediately put in place. Together, I do believe we can make a difference, and it is never too late for positive change.
Thank you, Dr. Harrison. And our next greeting is going to come to us from the Caribbean College of Family Physicians, and it's presented by Professor Marvin Reed, who is the president of the Caribbean College of Family Physicians and a former president of the North American region of the World Organization of Family Doctors. He's a former deputy dean in our Faculty of Medical Sciences here at Mona, and is currently a consultant in the principal's office on the Mona campus. So without further ado, Professor Reed, over to you.
Thank you, Marshall, and congratulations to the team for the launch of this very important publication, the 2024 Small Island Developing States Report of the Lancet Countdown. Indeed, it's on behalf of the Caribbean College of Family Physicians. I'm pleased to share a few remarks with the group this evening on the occasion of this launch. The Caribbean College of Family Physicians, since its inception in 1988, has been a firm advocate for health equity. That is, the fair and just distribution of health resources, opportunities, and outcomes across all populations. In deference to our chosen speciality, we posit that a significant pillar for achieving this is through a fit-for-purpose primary healthcare system. Within this context, the college appreciates that environmental factors such as climate change is a key risk for the resilience of the healthcare system and for the attainment of health equity, and thus needs to be understood, researched, and planned for. Thus, we're all aware of the impacts of climate change on vulnerable small islands such as us, because it represents for us a lived experience. We are told by the climate change experts that we are to prepare for an increase in the extreme weather events, more intense heat, longer droughts, more frequent episodic flooding, more forest fires, and sea level rise. We live in an era of superlatives. We use words like unprecedented, historic, worst ever to describe our changing climate. No doubt, many of you would have seen the reports across many of the public media about January being the hottest recorded month in our history. Of the hurricanes that have affected the Caribbean, small island developing states, Hurricane Marina of 2017 was the most devastating, with an estimated damage of about 6 to 8.6 billion US dollars. Dominica was decimated and lost more than 95% of its physical infrastructure, including healthcare facilities. Dominicans are haunted by the fear of another devastating hurricane as they rebuild their country. The psychological impact of climate change on Caribbean people is therefore profound and multifaceted. The trauma of experiencing extreme weather events, the loss of homes and livelihoods, and the uncertainty about the future can contribute to mental health issues. The lack of mental health services and culturally appropriate support exacerbates these situations, leaving many without the care they need to recover and rebuild their lives. Climate change is altering the distribution and prevalence of vector-borne diseases in the Caribbean. Warmer temperatures and changing precipitation patterns create favorable conditions for the proliferation of mosquitoes, ticks, and other disease vectors. Globally, and certain among the Caribbean islands, we have seen more frequent outbreaks of arbovirus-related infections, such as dengue fever. The Caribbean region is experiencing a notable increase in average temperatures, leading to a host of health-related issues. Prolonged heat waves contribute to heat stress and heat-related illnesses, including heat stroke and dehydration. And this is especially marked in our vulnerable groups, such as the elderly and our children. Further, it will undoubtedly contribute to an increase in the prevalence of non-communicable diseases, as many persons will decline to exercise due to the extreme heat. Additionally, higher temperatures can exacerbate existing non-communicable diseases, such as cardiovascular and respiratory disease. Thus, given our high burden of chronic diseases, we can expect that a further exacerbation of all of these conditions. We already know that these unprecedented times will affect our health and the health of generations to come. If we accept this to be so, the obvious questions are, what are we collectively doing about it? Are we doing enough? Are we addressing the impact of climate change with the urgency that is required? The role of the medical fraternity, including specialties such as the family physician specialty, cannot be overstated. Within that context, the CCFP will forge ahead in advocating for greater attention, recognition, and actions to be taken about climate change, and will work diligently with our partners and other stakeholders to push this agenda in order to build a more resilient health system and thus achieve health equity. We're also looking forward to collaborating with the Small Island Development State Regional Center in research on climate change and health. Thank you, ladies and gentlemen.
Thank you, Professor Reed. All right, so we move on to the last sort of clinical greeting, and this is going to come to us from Professor Denise Eldemar-Shero, She's a well-known gerontologist and executive director of the Mona Aging and Wellness Center. She's had over 40 years of experience, practical experience in public health and also in care of the elderly. And at this time, we'll take her greetings.
I'd like to congratulate the Regional Center on Small Island Developing States of the Lancet Countdown on Health and Climate Change on the launch of their inaugural report, which includes an important topic in it, that of older people. We know that older people are more vulnerable to the effects, particularly of heat, because of the physiological changes in the body, the inability to respond as quickly as younger people, and because the ability to maintain core temperature is reduced with age, and adjustments are neither easy nor quick. We therefore get the impacts on the excess of fluids in the body. The risk of dehydration is much higher because you have changes in the cardiovascular system. The cardiovascular system cannot ramp up as quickly as younger people, and therefore the fluid is retained. It reduces the ability of the body to shift blood to the skin. We all know that the skin is the major cause for evaporation of heat through sweat. Also, sweat glands in older people decrease in number. So again, there are two contributors to that. Cardiovascular work, having to work harder, is also going to put the body at risk of heart problems and even increased risk of heart attacks. Heat can affect the nervous system. We quite often see older people who have got dehydration or fluid overload, either one, presenting with confusion, some even memory loss, acute versus the memory loss of dementia, and even delirium. And therefore, it is important for us to monitor heat and to give advice. The report speaks to the increased number of heat days. All of this is going to take its toll on older people. But heat is not the only impact of climate change. Disasters are a particular problem for older people, and we have seen the increase of disasters. One thinks only of 2024 and the number of weather impacts that we had. Older people don't have the money to batten down. More importantly, even when they have money, older ladies, and we have more older ladies among the older group, cannot climb on rooftops to batten down and cannot put up the zinc or the plyboard on windows. There is also the issue of poverty, the issue of declined income. How do they buy things for 3 weeks? So these are things that we want to remember. For these reasons, I again congratulate the Regional Center on Small Island Developing States of the Lancet Countdown for highlighting these important issues and allowing society, families, communities to focus on the needs of vulnerable groups, of which our older people are a major group.
All right. Thank you, Professor. And now we are moving into the Lancet perspective, and we'll hear from Dr. Marina Romanello, who is with the Lancet Countdown. She's Executive Director of the Lancet Countdown on Climate Change and Health, and she's at the University College of London. She has her PhD in Medical Sciences from the University of Cambridge, and her work has spanned a number of areas in the issue of climate and health. So I hand over now to Dr. Romanello.
Hello, everyone. My name is Marina Romanello. I'm the Executive Director for the Lancet Countdown on Health and Climate Change, and I'm so thrilled to be here with you today for the launch of the first Lancet Countdown report for Small Island Developing States, a huge and very important contribution from our Small Island Developing States team, and a huge contribution also to the scientific literature of climate change and health in some of the world's most vulnerable regions. Today, I'm going to tell you a bit about the findings of the latest Global Lancet Countdown report, which we published in last November. and which is the product of the work of 57 contributing organizations from around the world, and 122 authors that contributed to this effort. The key finding of this Lancet Countdown report this year is that across the 15 indicators in which we're monitoring the health hazards and exposures and risks of climate change, 10 have reached a concerning new record high in the latest year of data, with, as you can see on screen, a very clear trend towards rapidly worsening health conditions due to the changing climate. And to give you a very brief overview of what these findings are showing us, for example, we're seeing that heat-related mortality of adults over 65 years of age has increased since the 90s by a record 167% by 2023, a record high level, and way higher than 65% increase that we would have expected without temperature change. We're seeing also, and you can find this in the report, many more health impacts of extreme heat exposure, including mental health impacts and impacts on our labor productivity, physical activities, etc. With climate change, we're also seeing a change in precipitation patterns, and we see that a record 61% of the global land area saw an increase in the number of days of extreme precipitation in the latest year of data with respect to previous decades. And this translates to increased risk of flash floods, of damage to infrastructure, and of the transmission of disease associated with extreme precipitation. While simultaneously, we're seeing also that almost 50% of the global land area was affected by extreme drought events in 2023, up from just 15% in the 1950s. This undermining our food security, water security, sanitation, and with cascading impacts for health that can be long-lasting. We're also seeing through our report an increased risk of transmission of climate-sensitive and deadly infectious diseases, including, as you can see on screen, dengue, for which we're seeing a 46.3% increase in the risk of transmission by Aedes albopictus globally. We're also seeing an increased risk of transmission of diseases like malaria, chikungunya, Zika, West Nile virus. And we're also seeing an increased risk of transmission of Vibrio, and we estimate a record high level of almost 700,000 cases in 2023 due to the changing climate and the hotter water temperatures. And these impacts are all happening simultaneously, adding extra pressure on health systems that are oftentimes already overstressed and struggling to cope, and health systems that are not prepared nearly enough to cope with the growing threats of climate change. So populations are increasingly at risk from climate change-driven impacts, and we're currently headed towards about 3 degrees of temperature rise because of lack of ambition in climate action. And concerningly, what we're seeing is that governments and companies worldwide continue fueling the fire, continue exacerbating greenhouse gas emissions, and putting at increased risk the health and the survival of people worldwide. We're seeing that greenhouse gas emissions from the energy sector have continued to increase and grew by 1.1% from 2022 to 2023. And the persistent over-reliance on dirty fuels and fossil fuels has led also to cascading health impacts. The persistent dependence on fossil fuels has led to high levels of energy poverty. About 2.4 billion people globally still rely on dirty fuels and inefficient technologies to meet their household energy needs. And about 92% of households in low human development index countries still rely primarily on the burning of dirty biomass to meet their energy needs, with the cascading impacts that energy poverty has for people's health and well-being. And because people are still dependent on dirty fuels to meet their energy needs, we're also seeing a very high level of mortality associated with household air pollution that comes from the burning of solid fuels. We estimate in 65 countries, 2.3 million deaths were associated in 2022 with the burning of solid fuels in people's homes. These deaths that could be avoided by providing access to clean renewable energy. And the dependence on fossil fuels has also had other impacts on people's health and on our countries, our well-being. We've seen that because of the very high energy prices, countries have increased their efforts to subsidize fossil fuels to keep energy affordable. And that has resulted, due to the energy crisis, in a net total $1.4 trillion in net fossil fuel subsidies in 2023, a record high level that dwarfs any sort of financial commitments towards tackling climate change. 1.4 trillion, US dollars that could have been allocated to activities that promote and improve people's health and well-being, and instead were allocated to subsidizing fossil fuels. At the same time, we're seeing that due to the energy price increase, fossil fuel companies are increasingly expanding the oil and gas activities driven by record profits as well. And with the latest developments, obviously, with some countries reversing climate commitments, this becomes particularly concerning. We're seeing that the health of the most vulnerable populations is being increasingly put under threat. And we have here a moment in which we do need to advocate towards preventing the worst health impacts of climate change with coordinated response across all of our social systems. And most importantly, by putting people's health and well-being as a central priority in how we respond to this challenge. And small island developing states are at the forefront of climate change, are the front line of the impacts that we're seeing, and also are the states that have been the most vocal in terms of requesting a sustainable transition to a healthy future, in terms of promoting the protection of people in every country. So I do encourage you to read the report of Small Island Developing States. And with that, I will just thank you very, very much for your attention and hand over to the team to tell you a bit more about our findings there. Thank you very much.
Thank you, Dr. Romanello. And I think this is a moment that most of the attendees have been waiting for, to hear a little bit more of the report from the Small Island Developing States. And I know I'm going to invite Dr. Georgiana Gordon-Strawn, who is actually the director of the Lancet Countdown of Regional Center for Small Island Developing States and the director of the Tropical Metabolism Research Unit of the Caribbean Institute for Health Research, in which the center lies, to give us some details on the findings from this tremendous work.
Thank you very much, Professor Tuller-Reid. And good day, everyone. Good day, ladies and gentlemen. We thank you so very much for joining us at this launch of the 2024 Small Island Developing States inaugural report of the Lancet Countdown on Health and Climate Change. The report was published in January of 2025 in the Lancet Global Health Journal, and you may access this link at the end of the presentation. So we're going to put the link at the end of the presentation. I just want to say that what I'm about to present is not a comprehensive review of what was done. So I implore you to have a look at the report for a more comprehensive discourse on what we found. So we had authors from 22 institutions represented here, and we had 35 authors in total, 26 of which came from Small Island Developing States. The project was funded by the Wellcome Trust through a grant to the University College of London, who oversees the Lancet Countdown's Health and Climate Change. The report represents data from 59 countries, UN countries defined as states at Small Island Developing States, and it includes 31 countries from the Caribbean, 20 countries from the Pacific, and 8 countries from the Atlantic and Indian Oceans and South China Seas regions. We looked at 25 indicators from 5 working groups, and these were developed by over 100 leading researchers worldwide. We also used the Lancet's framework for these working groups. And this diagram shows the 5 working groups that are used for the Lancet Countdown framework. And it also shows how they relate to each other. So the working groups are Working Group 1, which is health impacts of climate change. Working Group 2, which looks at health adaptation. Working Group 3, which looks at health benefits of mitigation. Working Group 4, which looks at the economic impacts and transition, and Working Group 5, which looks at public and political engagement. So let's start with some results from Working Group 1. The report really shows the importance of health and heat and the impact of heat on our populations. Heat was the most pervasive aspect and the most pervasive finding in this report. And this slide shows the record-breaking heat exposure to two vulnerable groups, children under 1 and adults over 65 years. And what we're seeing here is that in 2023, children were exposed to 41 heat wave days, and the elderly were exposed to 43 heat wave days. And this actually represents 48 times higher exposure to heat wave days than our reference period of 2000 to 2004 for people over 65. And for children under 1, this represents a 36 times higher. And this was in 2023. And you will recall that in 2023, the records for summer heat was at an unprecedented high. This next slide looks at health-threatening heat exposure. And when we compare this with a reference period of 1990 to 2000, what we see here is that even though we are encouraged to practice healthy lifestyles and to include physical activity in our daily lives, when we looked at least moderate, and that is light intensity, which would include walking as a physical activity, in the period 2014 to 2023, we were exposed, if you were doing light intensity, 388 more, exposed to 388 more hours of health-threatening heat. And this compared to the baseline period of 1990 to 2000. So we are going to have to really look at the recommendations that we give and to also look at how we create physical spaces that can alleviate this unprecedented heat. As we move on, we also wanted to look at the impact on livelihoods. And one way of looking at this was to look at the effect on labor capacity. And labor capacity is the ability to do work, to do optimal work. And for the guidelines, usually we use the ability to do 8 hours of work under normal weather conditions. Now, this slide shows the change in labor capacity for the Caribbean, for the Pacific, and for AIS. The orange bars demonstrate the period that we're examining, and the white bars look at the reference or baseline period. And for the Caribbean, what we're seeing is that there has been an increase in losses. So we're looking here at work hours lost in millions, or potential work hours lost in millions by different sectors. So for the Caribbean, the agriculture sector was one of the highest affected, along with the service industry. For the Pacific, we didn't see a similar profile. For them, agriculture was actually less. However, the AIS profile for agriculture was similar to that of the Caribbean. Remember now, we're looking at potential work hours lost in millions. So let's then have a look at what that cost might be. And indicator 4.1.3 looked at loss of earnings. And I'm sorry, I'm going too fast, looked at loss of earnings. And what we saw here was that SIDS lost around $273 billion in potential earnings due to heat-related labor capacity loss. And the comparison here, and I'm sorry, and we're looking at over a period from 1990 to 2023. And this amounts to about 2.1% of the average GDP of SIDS and US 12 billion potential earning dollars lost. If we look at heat attributable deaths, and I'll hasten to say that this method of calculating this or estimating this is through statistical modeling. And what we saw was that when we compared 2000 to 2009, we saw that the Caribbean had the highest potential heat attributable deaths. So I'm telling you that we have to pay attention to heat. And then when we look at this in terms of the economic cost of years of life lost, we see that there is a rate of 20 billion lost per year to deadly heat. And this is in terms of years of life lost. So it's a calculation to try to monetize what years of life lost due to deadly heat will be for small island developing states. Now, if we shift our attention a little bit to look at climate sensitive diseases, we heard this in our presentations earlier. Professor Marvin Reed spoke about it. Professor Denise Eldemaya-Shera also spoke about it. And what we're actually seeing is an increase in suitability for the transmission of dengue, climate suitability for dengue fever. And you'll see here that if we look at a baseline period, 1950 to 1960, that our climate suitability for the transmission of dengue has gone up by 33%. Another climate sensitive disease is Vibrio transmission. And we looked at the potential for Vibrio transmission. And what we found was that elevated sea temperature actually contributed to 27% more coastline being suitable for Vibrio transmission over the period 2011 to 2022. Now, when we look at malaria and malaria transmission, we're not seeing an increase in climate suitability for SIDS. However, we should not take heart in that because the transmission season for malaria is still high, still comparatively high. So while it hasn't increased, and we're happy about that, we still have work to do to try to reduce malaria transmission. We move on to looking at food insecurity. And we try to estimate the level or the association between heat wave days and the number of additional people who have experienced moderate or severe food insecurity. So as you can see, the trend is upwards. The blue line represents heat wave frequency, and the orange dots represent drought frequency. And heat wave days was associated with 1.7 million additional people being moderately or severely food insecure. And droughts accounted for 900,000 additional people experiencing moderate or severe food insecurity. So I'm going to shift gears a little bit, and we're going to talk a little bit about health adaptation. Now, one of the indicators that we looked at was urban green space. And the colors here represent high, moderate, low, and very low. I want to point your attention to Cape Verde and also to Fiji. So Cape Verde is the only country that had green, dark green, which is very high urban green spacing. And I want to point out that Fiji transitioned from moderate green space, urban green space indicator to very high green spaces in their urban spaces. So it shows here that some of the policies that are being promulgated and enacted are actually working. We have other countries as well who have similar, for which we have similar findings. So I wanted to point out to you that Barbados actually made the shift from being low to being moderate. This also happened for the Maldives, as you can see here, for Mauritius, and for Papua New Guinea. So we still have work to do because we still have a few that are very low. And this is an important adaptation mechanism, which is not a costly intervention. So when we looked at tools for climate-ready health systems, we looked at two indicators for this, one that looked at assessment and planning of health adaptation. And I hasten to say that this only represents 24 countries that reported on this. But also to say that these data represent 2023. And I know that a lot of work went in 2024 around doing national health vulnerability and adaptation assessments and around developing national health climate plans. So we're hoping that for next year's iteration, these numbers will climb. Now, in terms of climate information for health, about 13 countries reported that they engage in climate projections. When we look at climate information and climate-ready health systems, when we look at general surveillance systems for health and climate, if we look at these two categories, mental health and health-related illnesses, we will see that mental health, we have more surveillance on mental health than heat-related illnesses. Again, bringing up the point about we need to pay more attention to heat. For early warning systems, about 5 countries had heat-related early warning systems. And I want to draw your attention, though, to the integrated system, which is where health is integrated into the meteorological surveillance system. And for mental health, we actually had 2 countries, Cuba and the Marshall Islands, that had an integrated system of meteorological surveillance with health surveillance for mental health. We then went on to look at funding for projects. And I have to confess that what I'm presenting here is not a comprehensive source. It is data from the Green Climate Funds. And what we found was that none of the projects that we looked at specifically spoke about health. However, there are several that are social determinants and other environmental determinants of health. So you will see that there is funding on food. You will also see that there was funding provided for flood management, water and sanitation, heat, and water security. So there are aspects of this where we assume that if these are addressed, then health will be positively affected. The next indicator that I want to bring to your attention looks at the detection, preparedness, and response of health systems to emergencies. And I really like this slide because it makes me happy. It shows that most of our countries have scored high or have very high capacities for planning of health emergencies, for the management of health emergency responses, and also for emergency logistics and the supply chain management. So we are doing good with the detection, our preparedness, and our response to health emergencies. However, while we are doing good with reducing lethality for storms, we're seeing where the economic costs due to climate-related extreme events has been going up. And there's a blip in this chart because it records 2 of the most devastating hurricanes that hit the Caribbean, and this would be Hurricane Maria and Hurricane Irma. But when we look at the lethality of extreme events, we're seeing that this is declining. So what this is saying is that even though we are having extreme events, we're actually having less deaths as a result of extreme events. But while we're having less deaths, it's costing us more because of the magnitude of these storms that we have been experiencing in more recent times. So we decided to have a look at whether or not lethality of extreme events, if there was any kind of association between lethality and the HDI of the Human Development Index of countries. So we divided the countries into their groupings, and what we found was that this is comparing 1990 to 1999 and 2014 to 2023. And what we found was that countries with lower HDIs tended to have less deaths than previous periods. We also saw this for countries with high. Countries with medium HDI seemed to have more deaths than with the reference period for extreme events, but this is where I would like to draw your attention. Countries with very high HDIs had a 4 times lethality in their experience, 4 times lethality from extreme events compared with the reference period. So this reiterates one of the points that has been made about small island developing states, which is that even though we may be high-income countries, or some of us may be high-income countries, our vulnerability to climate change is still quite high. Now, Dr. Kaffour spoke earlier about migration, displacement, and rising sea levels. So I won't go into this in any more. Our findings basically compare with what he said. He mentioned the agreement that was made between Tuvalu and Australia. And this agreement looks at migration-related measures, because Kiribati noted that they would be losing land and decided that they needed to be able to move their populations to another land, to somewhere else in the event that they were completely sunken. And so they forged a relationship and an agreement with Australia. And there are other examples of this happening now. Now we need to pay attention to this migration and the displacement, because what has happened is that spaces of sacred spaces and of cultural relevance have been lost. So sacred burial grounds have been sunken and underground. And what we're seeing is that these may actually cause a loss in current cultural practices. So we really do need to look at this. I won't speak about the migration issue. I think it is out there for the world to see. A lot of people have had to leave their homes because they have not been able to feed their families because of things like desertification and other impacts of climate change. So as this continues, we can expect to see more displacement, more migration. Some migration will be internal, other migration will be external. And we're very small islands, so sometimes there's nowhere internal to go when these islands sink. So I'm gonna look now very, very quickly. I only have a few indicators that I pulled out to show you on the economic impacts and the transition. So the first slide that I wanna show you is looking at green energy potential within the small island developing states. Now, we have not sufficiently taken up this charge for renewable energy. Let's look at this slide, which is on this side. The little green marks that you see here are what represents renewables. As you can tell from the orange bars, we are still heavily reliant on fossil fuels. Now, I want to pull your attention to the slide on the right in the corner. And this shows what we've been using, where our renewables are distributed. So the greatest amount of our renewables is from hydropower, then solar, and then wind. So there is so much more to be done here around renewables. And it's a clarion call for us to pay attention and to try to increase our renewables and to reduce our dependence on fossil fuels. We also looked at diet and health co-benefits, and we found that nearly 20% of deaths are associated with poor diets. Poor diets meaning an overconsumption of high carbon producers. So in other words, an overconsumption of red meat and sugar and an underconsumption of fruits, vegetables, and whole grains. And you can see that for the 3 SIDS groups that we looked at, no SIDS region had less than 100 imbalanced diet deaths, and this is an estimation per 100,000 people. So here is where a co-benefit is easy and quick. We need to change our diets. I know I'm going to be told that it's not easy and quick. If it were, we wouldn't have this problem. But we really do need to look at this because changing our diets will redound to better health as well. So that's a great co-benefit right there. Okay, so I'm going to close off with public and political engagement. And I'm going to just show you, I think, 1 or 2 slides. The first slide looks at the government engagement in health and climate change. And what was done for this was that we looked at the UN General Assembly meetings and the statements that were made from countries, from SIDS regions, so AIS, the Pacific, I'm sorry, the Caribbean and the Pacific. And what we found was that they mentioned climate 56% of the times for AIS and 39% of the times they spoke about health. But 5% of the times for both AIS and the Caribbean, they spoke about the nexus between climate and health. So the connection between health and climate was recognized and mentioned 5% of the times by these 2 regions, SIDS regions, at UN General Assembly meetings. However, the Pacific mentioned and saw this nexus as important, and they spoke about it at the UN General Assemblies and their statements. They made 9% of all their statements were about, 9% of all their statements was about the nexus between climate and health and the realization of this intersection and the importance of addressing this intersection. The climate crisis is also a health crisis. When we looked at nationally determined contributions, we were happy to note that the second submissions mentioned health an average of 19 times more than the first submissions did. Now, we cannot depend on governments to do everything. A lot of what we do is also controlled by the private sector. And there is an indicator which looks at the corporate sector engagement in health and climate change. And what we found was that there were 36 reports, but these 36 reports only came from 3 countries. And most of these reports came from Singapore. So there were 30 Singaporean companies that reported on their progress on the Global Compact Commission, UN Global Compact Commission. Now, one of the challenges with this commission and the progress is that it is voluntary reporting. So we really do need, I know that several private sector companies have been trying to address and adapt to climate change and are using innovative ways of doing it. So I think we need to really ask, appeal to our private sector to try to complete these reports so that we have a better sense of what is actually going on in the private sector. And I will close, I think, my last slide is looking at scientific engagement in health and climate change. Now, of the 59 states, we only had 75 peer-reviewed articles studying health and climate change on SIDS in 2023. And this is an average of about 1.2 articles per country. We really, really, really would like to address this. And my next slide says, but, there are lots of opportunities for us to bridge these gaps and to look at trying to come up with new indicators. Okay, so we have so many things that we can do. Now, one area that we did not get to do a lot of work on was things like air quality and pollution. So I'm stating this because the global report had 53 indicators. And our report had 25 indicators. And the reason for having 25 indicators is that we did not have enough data to report on all of these indicators. So this is a great opportunity for collaboration, for more work to be done to address these conditions and these themes. So the legal framework for net zero transition, we have to look at that, private sector adaptation efforts, but other things as well, such as non-communicable diseases, mental health outcomes, water sanitation, and hygiene, to name a few. So I'll close with the report and the link to the report, which should be posted in the chat right now. As I said before, my presentation was not a comprehensive presentation because in the interest of time, I tried to pull on the results that I thought were most relevant to us. But please do a deep dive into this report for us, again, I say, a more comprehensive discourse on what is going on with the small island developing states and health and climate change. So I want to thank all the countries that were involved, and I really like flags. I think flags are very beautiful. So we chose to display all the flags. And I also want to thank the authors who gave freely of their time to pull this together. We thank them very much. A special thanks to the Lancet Global team for their continued support, and for the Lancet Global team authors who gave us advice and guided us as we moved through trying to get the report done. I'm going to say this now. We had two very special junior research fellows who worked with us on this, and they are Kimali Parchment and Stephanie Parker, and I would really like to publicly acknowledge their contribution to this report. So thank you, ladies and gentlemen.
Thank you very much, Dr. Gordon-Strawn, for giving us that bird's eye view of the report. There will be more time for questions as we hear from each of the theme leads. And at this point, I'm going to hand over to Dr. Gordon-Strawn as we close this opening ceremony and transition into discussion on the main findings from the report. So without further ado, I'm sorry you don't have a minute to gather your gather your thoughts, Dr. Gordon-Strawn. I hand over to you to take us through the reports from the various chairs.
Okay, thank you very much, Professor Tuller-Reid. And ladies and gentlemen, we didn't think it would be right to just feed you the report, feed you the findings, and then leave you. We thought it would be useful for you to get a context, to appreciate the context within which these findings are embedded. So we thought it would be useful to have a panel discussion with the working group leads for each of these thematic areas. So I am going to call on them right now. From working group 1, we have working group 1, we have, allow me to pull up my notes, Liamania, Dr. Rouhani Nashu, and she was responsible for working group 1. And what I'm going to do is to just tell you a little bit about her, and then I'm going to move on to the next person. So I'm going to go ahead and introduce everyone, and then we can get into the chat. Okay, get into the conversation. Sorry. So Dr. Rouhani is a human geographer whose work focuses on Pacific health, education, and sport in Australasia and the Pacific region. Her PhD really focused on Pacific health workforce development for examining the health and education inequalities and inequities for Pacific communities in New Zealand. And Dr. Rouhani hails from the village of Savia in Samoa. From working group 2, we have Dr. Salanita Saketa, and she is a senior epidemiologist of the Pacific community in the public health division, and she specializes in public health and epidemiology and has worked in this field for 20 years. And Dr. Saketa was responsible for Working Group 2, and Working Group 2 looks at adaptation, planning, and resilience for health. From Working Group 3, we have Dr. Pablo Mendez Lazaro, and Dr. Lazaro is currently the leader of the Puerto Rico Climate and Health Research Group, and he's an associate professor at the Department of Environmental Health of the University of Puerto Rico, their Medical Sciences Complex. He also is a member of the faculty for the Graduate School of Public Health. Dr. Lazaro is one of our air quality experts, and we're really very happy to have him here. He's written extensively on the impact of climate change on health in the Caribbean. For Working Group 4, we have Dr. Heather Harewood, and Dr. Harewood has been involved in the administration and delivery of the Masters in Public Health program at our Cave Hill campus, University of the West Indies. And she also has as her research interests in health systems-based research with a focus on maternal and child health. Dr. Harewood is an expert in health economics and has been trained in health economics, and she's a collaborator on the Global Burden of Disease Institute for Health Metrics and Evaluation. So welcome, Dr. Heather. And we close out with Working Group 5, and we have Dr. David Smith. And Dr. David Smith is the coordinator of the Institute for Sustainable Development and the director of the Center for Environmental Management at the University of the West Indies in Mona. He is also the Caribbean coordinator for the Sustainable Development Solutions Network, and he was a member of the independent group of scientists who prepared the UN Global Sustainable Development Report of 2019. Welcome, David. Welcome, Dr. Smith. So what I'm going to do right now is I'm going to ask each of the working group leads to tell me what surprised them about this report, what was the most important finding for them. And I'm going to start with Dr. Rouhani, who is for working group 1.
Warm Pacific greetings. Thank you, Dr. Georgiana, for the opportunity. I think, as you had mentioned, the fact that the Pacific talks a lot about this nexus between climate and health. One of the things that the report actually highlighted is the importance of looking at chronic NCDs alongside with heat and rising temperatures, and it's important, I think, to promote practices that sort of enhance our food security as well as reducing our dependence on external food sources. And this also ties in with the finding on vulnerable populations, especially our infants and older adults who are particularly at risk due to the changes in our climate and in heat. Thank you.
Thank you. Thank you, Rouhani. I hope you don't mind me calling you Rouhani. I think we will go by first name basis once I've introduced everybody. So I'm going to ask Salah if she could tell us for working group 2, what was the most important finding or what was surprising to her about the results that she got. Salah?
Bula, and thank you, everyone. And thank you, Dr. Georgiana, for that introduction and also for the presentation of the report. And just from what really struck me about the report and the findings, particularly for working group 2, the fact that health adaptation to strategies to mitigate the climate impacts on health is really wanting in seeds, and particularly in the Pacific. I think that was the most striking results that I saw in the various indicators that we looked at.
Thank you. Thank you, Salah. We're now going to ask Pablo. Pablo, the question you heard, what was the most important finding or what was the most striking thing for you about this report when you look at it through the lens of working group 3?
Well, thank you, first of all, Georgiana, you and your team, and the rest of Lancet for inviting me and for being part of this. It's an honor. I think that one of the most shocking thing that we found is that obviously all of the islands are already facing climate extreme events, and these extreme events are exacerbating the existing inequalities and impacting human health and well-being. In our working group, so we had a couple of estimates early before working in this report, but it was shocking to actually identify that these islands are only contributing less than 1% of the global greenhouse gases emissions. Unfortunately, small islands are the ones that are facing an array of climate effects, right? But also, on top of that, all of these islands are highly dependent on fossil fuels. So meaning that all of these extreme weather events are coupling with the absence of climate actions, some political crisis, and the lack of government support or initiatives in transitioning into, or for whatever reason, right? We can discuss that later probably, into renewable energies, right? So this dependency is directly associated with several health complications, especially with respiratory illnesses. But it's worth also to highlight that some of the islands that we work with are one of the highest oil consumption per capita of the world. So even when we're only contributing 1% or less in terms of per person, we are one of the highest oil consumption.
Thank you for making that point, Pablo. That was that I missed that one, that we were among the highest consumers of fossil fuels. So I'm going to hand over to David now. David, can you tell us, when you look at public engagement and the political context, what came out to you? What really surprised you about this report?
I would say probably the contrast between the really good advocacy that SIDS have managed to do, say, in the UN, where we've told the world about climate and how it's affected us. And as a result, we've seen the UN coming up with something called the Multidimensional Vulnerability Index. They've set up a loss and damage fund. The loss and damage fund, unfortunately, while it's getting pledges, isn't nearly as large as it needs to be, and the pledges aren't being followed up. But there's a contrast between what we've said as or what our governments have said in international fora, and then what's happening back at home in terms of things like research, as you pointed out in your presentation, low levels of research, 1.2 papers per country, not really enough to be able to understand the problem and how it affects us, not really enough to get enough details on, say, climate and health to be able to fix the problem internally. And also the low level of involvement of our corporate entities, our companies not yet getting nearly involved as they should be. So that's, I think, the contrast is what came to me most.
Thank you, David. That is very, very, very interesting observation. So we are doing a good job and in the international arena, but back at home, we're not doing as well, is what I hear you saying. So I'm going to ask, I'm going to pick on Roani again, and I'm going to ask Roani if you can tell us maybe what are the implications of the findings from Working Group 1, the ones that you spoke of, and what are these implications to the health of people living in small island developing states? So you spoke specifically about the NCDs happening alongside heat and this promoting food insecurity. I wonder if you could tell us a little bit more about the implications of that for people living in cities.
Thanks very much, Georgiana. So I noted there was a question around nutrition and food insecurity. And for the Pacific and a lot of the SIDS, we rely a lot on our marine sources for protein and for food and our livelihoods as well. And so given that sea temperature is rising, but also sort of growing coastlines and loss of arable land, we are relying heavily on external foods that have very low nutrition. And so for us, I think one of the things that is really important is promoting or finding ways in which we can develop more sustainable agriculture in a way that we can grow our own. Also looking at ways where we can protect our marine food sources, and then sort of not rely too much on external food sources as well. So imported food, like bad quality rice. Some of these things are, we talked a little bit about corporations to do with world trade agreements. So it really is a collaborative and collective effort at a global scale in order for us to address these really complex problems.
So Salah, you spoke about the health adaptation strategies wanting within the small island developing states. And I wondered if you have any ideas on how we might be able to address that problem in SIDS.
Yeah, thank you, Georgiana. If I may just expound a bit on what I mean by being wanting. In the data that we looked at, there were 24 countries, and 9 out of the 24 countries that we had data on were able to, out of the 24, 9 were able to do a vulnerability assessment and risk assessment, which needed information and evidence that will help inform their national health adaptation plans. And so if they do not have the necessary evidence that should inform these plans, and even if they do have plans, they do not have an evidence-based plan that will help them in strategizing what their health adaptation strategies would be. And so, yeah, so that's what I meant about being wanting. And also in the same way, in terms of their use of early warning systems and climate information, as you indicated in the summary of the report, that not many countries are using climate or weather information that can feed into their epidemiological data to be able to have a predictive tool or an early warning system to predict, whether there's going to be a dengue outbreak or chikungunya or Zika or even the other climate sensitive diseases. And one of the other things also that was in the report was around also mental health, just a few countries that had early warning assistance towards mental health and heat-related illnesses. And given the data that you presented around heat in the SIDS, yeah, that's really, a real gap for countries to be able to have those information and the data that's required to be able to inform their national health adaptation plans and strategies. And so, and one of the findings that we had in our working group was around also resourcing. Even though for those countries that were able to do the vulnerability and risk assessment and have a national health adaptation plan, plans were just sitting there and not resourced. And so how would they be able to implement those strategies if they did not have the necessary resources? And so one of the key things that I think is important to raise is the need to strengthen that national effort and regional effort and also global effort to resource mobilize. And we also saw that in the data that how, even though they were, seeds were having access to the Green Climate Fund, but not much was coming towards addressing the health impacts that the countries were facing, and even for cooling in terms of in regard to heat. Yeah, not much was coming into the seeds, and so there's still a lot to be done. And I think encouraging, regional, national, and global cooperation is really key as well to try and strengthen health adaptation to climate change.
So thanks for raising that, Dr. Salah. Just to say too that the slide that looked at the funds from the GCF, from the Green Climate Funds, even though the amounts that are stated there include SIDS countries, in most situations, a SIDS country was one of many countries benefiting from the fund. So we still need to disaggregate that even further so we can have a better sense of how much of the GCF is actually going to health and to SIDS respectively. And so I'm going to ask Pablo. So Pablo, you spoke about climate actions and government support, and also you spoke about the dependence on fossil fuels. And I wondered if you could maybe give us some idea on how we might move forward with this. So many countries have in their nationally determined contributions stated what their energy mix is going to be, and they have a goal to reduce fossil fuels and to increase renewables, but this doesn't seem to be happening quickly enough. Do you have any thoughts around how we might energize that or catalyze it or help countries to move forward with this?
Wow, that's $1 million question. How do we move forward with this transition in renewable energy in small island states, right? So what we're seeing is that our findings are highlighting the potential for delivering interventions that offer multiple benefits, including the reduction of greenhouse gas emissions. How to do that? Wow, it's very complicated. So what we're seeing is that it's some of the islands that have some kind of relationships with continental countries because of their political background and history back in the colonialism era. So because of that relationship, some of the islands have been able to start in a certain degree the transition. But being honest, what we're seeing is that we're not moving fast as we want to, right? So this highly dependent on fossil fuels are also highly dependent on the decisions on metropolis or other countries, industrialized countries, are making it a little bit more complicated. Access to renewable energy has been a challenge. So what we're seeing in some areas is that NGOs, non-governmental organizations, community-based organizations are taking the lead as well in providing this kind of access and resource as the one that you mentioned internationally, but also they are coupled or making alliances with local community-based organizations that are more directly working with community residents, community businesses, schools, and multiple other sectors. So I, I think that is gonna be something related with what will happen now as well at the international scenario. What we're seeing as well in the international movements in COP, what we saw, and James, I think that I saw one of your questions there, and I know that probably you're still connected here. So how do we deal with that? How do we have a same voice as islanders to be listened and advocate for the benefit of our people, the islands, right? There are multiple others international initiatives that are island networks that are aiming to do that kind of things of giving a voice to islanders in these high-level decision-making activities, such as the United Nations. So some of the challenges, specific challenges, are highlighted in the report. And I will, as you mentioned before, Georgiana, I will encourage the participants here to take a look at the report, to take a look at the manuscript, and also feel free to jump with new ideas, contacting us, because one of the richest thing that I will say that I obtained by participating in this report as well is only in the sector health component, the climate and health interaction. It was also building this kind of relationship with multiple other people that are facing similar hazards and challenges on islands worldwide. And that experience is amazing as well. So yeah, thank you, Georgiana.
Okay, thank you. So Heather, I wanted to find out from you, because you looked at, I think, one of the most important decision rules. I know that when we're trying to make decisions, we try not to be too influenced by cost, but we're always influenced by cost. And I wondered if you could give us some idea on one, what was most important finding around cost and economics. We spoke about the cost of years of life lost due to, or potentially lost due to health-threatening heat. And I wondered if you could give us some ideas about what was surprising to you in that report, but also finish those ideas with what you think we can do. So it's a two-part question for you, Heather.
Okay, thanks, Georgiana. So with regard to the economic and financial aspects of this report, things that came out that could be described as surprising, but important to us was the whole capacity for these losses, economic losses, to disrupt the societal gains that we have achieved. So we started this evening speaking about the Moyne Commission and the efforts to improve public health in the Caribbean, but we know similar things have occurred across other SIDS. And what really came across was the high socioeconomic impact and the fact that even though we're all SIDS, there are some differences, which I think is important, because then with respect to strategies that need to be employed, is not a one size fits all. So it's like a collage of problems and a collage of solutions will be required. So within the Caribbean, for sure, one of the main issues would be I would say, precipitous events like hurricanes. I think we all are well aware of what happened in 2024. And interestingly, there was a higher impact or higher economic loss within the high and very high human development index countries within the region. And that really reflected a catch-22. So you're having expansion in your economies, you're putting more infrastructure in, but then when a hurricane hits, a Category 5 hurricane, the losses that you incur are so much higher. So we noted that that was the sort of pattern for the Caribbean in particular. However, the other extreme events like floods and droughts, which we might not be able to measure as easily. So droughts, that was one of the things. Droughts are there, they're causing problems, and it seemed to be more of an issue in the lower HDI SIDS. So I think it's important to recognize that even though there are challenges, that the precipitants are different. And certainly, with respect to what could be done, I think it can be framed within the impacts, looking at health from a broad perspective. So we spoke about diseases, but there's also the socioeconomic impact. So we actually looked in this indicator at the loss of productivity. And we recognize that there was, a large proportion of losses. The report does say that between 1990 and 2023, if I'll just quote from the report, it says SIDS lost around $273 billion in potential earnings because of heat-related loss. And we look at labor capacity. So it is too hot to work a normal 8-hour shift. And what are some of the things? You ask for some solutions, and it means that we need to rethink how work may be ordered. Are there low cost or frugal innovations that we can bring in? Look at cooling systems. Do we look at work in the shade? Do we look at staggering working hours where we might start earlier and maybe have a break in the hottest periods? So these are some of the things that I think our policymakers will need to consider, because we need to be productive. And the last point I will make is that the sectors that we see poised to really bring about economic growth in SIDS, namely agriculture, construction, and services, including tourism, these are the high-risk jobs. So we're in a catch-22. The things that will propel us forward in restoring GDP are also the things that put us most at risk. So we really need to think about strategies to improve workplace conditions and to educate the public more on the things that could be done at the individual level, but we could look at it societally and, of course, at the policy level as well. Thank you.
Thank you, Heather. Thank you. Thank you for sharing that. That was excellent. Because it really highlights the problem that we're in. It is a catch-22. And as you move forward in your development, you just need one good hurricane to suck you right back under, and we're so vulnerable. So sometimes it feels a little bit hopeless, but there is always hope. And we need to think about how we will address these. Now that we know that that these things will happen, we really do need to think very carefully about how we can address them. So I'm going to close off this session with David. David will have the last word. David, you spoke about this kind of a conundrum of speaking out and being champions on the international arena, but not moving as quickly on the national and regional fronts. And I wanted to ask you if you could think of some ways that we could try to move forward. I asked you about what should we do to catalyze this? How can we move this forward? Because I think there is acknowledgement and recognition of the challenges, but what do we do?
A good question. I think one of the things we have to do is make sure that there's increased access to information. At the moment, we know bad things are going to happen, but we don't know exactly how bad or which part of our island they're going to be worse than others. We know, for example, that tourism is vulnerable, but we haven't yet got the level of data to be able to figure out, well, how can we make, for example, beach tourism, which pretty much all of us in small island developing states do, how do you remodel a hotel to deal with increased temperatures? We're not even sure that, we need to model what those increased temperatures will be and then figure out how we can address them. So definitely we have to increase the amount of data available and put more scientists to work to be able to come up with the answers. And these are social scientists, natural scientists, working with the people who are in the vulnerable corporate sectors, so the hotels and so on. Bear in mind that this all costs money, and so scientists aren't going to just wake up and start doing research. They have to eat like everybody else. So we're looking as well to corporate sectors to start working with government to put funding in to do the research that's necessary, particularly on looking at the vulnerable industries, but also vulnerable age groups. We talked about old people and young people being very vulnerable to changes in climate. And we know it's there, but we don't know the details, so we aren't yet there where we can create the solutions. And I think if we also need to make sure that our government starts to put in place regulations to protect the labor force against the problems that are going to be coming down in terms of increased height, increased heat, et cetera. So we do have a lot of work to do. I think we need to be much more open to making sure information is available, finding the funding as well from outside, but also being more creative about the financial resources we have. Because one thing's for sure, if the pledges aren't being met, we're going to have to rely more and more on our own resources, the resources of the SIDS, both the human resources and the financial resources. And we're going to have to work on our own to help solve many of these problems.
Thank you. Thank you very much, David. There was one question in the chat that actually asked about, is it possible, it's Daniel Walter's question. He asked, is it possible for SIDS to negotiate as a bloc with developed states for access to renewable technologies, since the elephant in the north is behaving in ways that increasingly makes life and livelihoods untenable in our native lands? And David, I wondered if you would take that question.
I think yes, we can negotiate. We are doing that with varying degrees of success. It's, I think, very frustrating sometimes to find that, you'll discuss things in a particular forum, and then when you all get to the particular international meeting, everybody doesn't agree with what was discussed at the forum and where we agreed before. We need to be, I think, a lot stronger in our negotiation. We need to be much better at it and much firmer on the positions that we take. We also need to be careful about these sort of broad brush okay, we will allow the SIDS to get X, because as was raised several times, the SIDS are all quite very different from each other. So we need, I think, to spend much more time coming up with better crafted negotiation positions, and also making sure that access to finance is better. We can't be in a situation where the IMF has described that access to climate finance for SIDS is unnecessarily complicated. If the IMF thinks it's unnecessarily complicated, then you've got a real problem. And so we need to start looking at that and making sure there is better access to funding, and that also the solutions are tailor-made to the different SIDS. There's a big difference between Singapore and Haiti, and all the shades in between.
Agreed. Thank you, David. Olatundan Ghaffari, I see your questions, and I'm going to try to answer outside of this chat, because we've gone way over 16 minutes over our end time. So I'm going to try to wrap this up. And we will, as I said, we will answer these questions. I hope you have I think we have access to you by answering this. I think the technical team will go ahead and post the answers to the questions that have been asked. Very good questions as well. Thank you, everyone. So at this point, I think my mother always says all good things and bad things come to an end, but I think I'll hold on to the good things this time. So all good things come to an end, and this has been an excellent, I think, presentation from our panels, from our panelists, and I think they gave us the truth about what they thought, and they were very honest in saying that as SIDS, there is so much more that we can do and should do. I'm going to hand over to Marshall, but I wanted to just again say thanks to everyone, especially my panel members, because they were the leads, they were our lead authors, and they really worked very hard to pull everything together. I also wanted to thank Danielle Buss, who I think is on this call, who was also the lead for the public engagement chapter of the report. And but David, I think Daniel will agree that David did a good job in fielding some of the questions. Daniel is from PAHO, and we want to acknowledge his contribution. So thanks again to everybody, and I'll hand over to Marshall. Also thanks to the IT technical team who worked with us, and to the Lancet Countdown support and administrative team who gave us a lot of support, especially on this occasion. So thank you all so much for joining us, and I'm going to hand over to our official chair, Professor Marshall Taylor-Reid, to wrap things up.
Well, thank you, Dr. Gordon-Stroud. Well, you've made my work very easy. So, I mean, I really want to congratulate the group on the work that has been done and the issues that you've highlighted in terms of the upcoming crises that a number of small island developing states will begin to face or are already facing from climate. As was mentioned earlier, we hope that this will energize you to identify new areas for exploration, new areas for advocacy. And I want to once again congratulate the team on a job well done and wish you all the best in your endeavors. I also want to end by just thanking all those who have joined us today for being part of this experience and this presentation. And we look forward to hearing from you and interacting with you in the days and weeks to come. So with those few words, I say my goodbyes.